My name is Heidi Chua. I'm a surgeon in the co-leader division here at the Mayo Clinic, Rochester, Minnesota. My specialty is pelvic floor dysfunction that includes fecal incontinence. By definition, fecal incontinence is the inability to control gas or stool. Normal evacuation requires several actions of the rectum to come together to have control of bowel movements. It's a fairly common disease, unfortunately affecting a lot of women, most likely. It could be secondary to several reasons: diarrhea, constipation, trauma during childbirth, surgical procedures that we do in our division, dementia, or psychological issues. We do see a lot of our patients here at the Mayo Clinic. When someone comes to my clinic, evaluations would include a complete history and physical, which would include asking questions about their bowel habits. So I encourage people to be comfortable discussing their problems with their primary care physicians and certainly with me. We go through the whole history of what their bowel habits have been like. We will do a physical exam in the clinic, which may include an endoscopy, which is a look into the rectum, and also a feel of the sphincter mechanism in the perianal area. Other testing would include ultrasound to look at the sphincter mechanism, and also manometry, which checks the pressure generated by your sphincter mechanism. Certainly for treatment of the fecal incontinence, we would start off with dietary changes to make sure that you control your diarrhea or constipation. We'd also talk about exercises, including Kegel exercises, or send you to a physical therapist who deals specifically with pelvic floor issues. If medications or conservative management do not help with your incontinence, then there's certain surgical procedures that are available. The common ones are called sphincteroplasties, where we repair the sphincter mechanism if there's a defect in the sphincter mechanism. A newer modality of treating fecal incontinence is something called sacral nerve stimulator. This is available at the Mayo Clinic. Unfortunately, there's no specific test for it. The device is the actual test for the stimulator. It comes in 2 separate surgical procedures. Both are outpatient and done with very minimal pain or complications. The results are very encouraging in that a good 90% of our patients are 50% continent when they have the device in place. There are other modalities that can complement the sacral nerve stimulator, but overall the sacral nerve stimulator at this point is a very promising device that allows our patients to gain control of their bowel habits and have a better quality of life. After the initial clinic visit, if we feel that you're a candidate for the sacral nerve stimulator, you'll be sent home with a bowel diary where we document your bowel habits for a 2-week period. After that 2-week period, we'll go ahead and then implant the first stage of the device. The surgical procedures are done in an outpatient setting under moderate sedation with local anesthesia. A small electrode is placed into one of the sacral nerves, which is in your gluteal area. It's attached to an external battery pack. So most of our patients have very, very minimal discomfort. The battery pack is turned on right away, so we expect to at least see some results right away. So we send our patients home with, once again, a bowel diary where they document their bowel habits for 2 weeks. Then we see them back in the clinic for a post-op visit and also to discuss the bowel diary. If there's a significant change in their bowel control, where they see a good result with the stimulator, then we put in the permanent battery pack. That's once again an outpatient procedure done under IV sedation and moderate sedation. The battery pack is implanted underneath the subcutaneous tissue on your right or left buttock, so people will feel it, but it's not very obvious. So you can wear normal clothes with that. The device is turned on right away, and we should expect the same results during your test phase as in the permanent phase. The mechanism of action for the sacral nerve stimulation at this point is not very well understood. What we believe in is that it works because it improves sensation in terms of recognizing when it's time to actually go to the bathroom to defecate. If the device is turned off or if the lead inadvertently gets broken, the symptoms of incontinence usually recur. That's usually a signal for you to call your primary care physician or your surgeon who put the device in to have the device inspected, checked out, or eventually removed and replaced.